Hi everyone, Dr. Michelle Mian here. What we're going to talk about right now are growth imbalances. So there are two main types of growth imbalances that I would like to discuss. The first is when the lower jaw hasn't grown as much as the top jaw. If we were to follow the side of the profile with the red line, we would see that there is some convexity or curvature to the profile inward. The other main type of growth imbalance is when the bottom jaw outgrows the top jaw. If we are to draw a similar red line, we will see that there is some concavity or a different curvature to this profile. Now, the way that the jaws align with one another also manifests in the way that we see the teeth fitting together. So if we are to look for this example here with the convexity, how that would look with the teeth, in general, we would see the top teeth set ahead of the bottom teeth. And that's because this lower jaw down here hasn't grown forward enough relative to the top jaw. Now let's compare and contrast that to this example over here, which reflects the concavity in the profile. This is where the lower jaw has grown more than the top jaw, so we see those bottom front teeth sitting outside of the top front teeth. Now, ideally, we want the jaws and the teeth fitting together in harmony with a profile that looks more like this, with a red line that's straight up and down. So I wanted to show you what that looks like with a diagram. So here's another side profile of a person. This blue box represents the top jaw, and this box represents the bottom jaw. And in general, we want the bottom jaw to be just a couple millimeters behind the top jaw to give us more of that straight, orthognathic, harmonious profile. So let's look at what the convex and the concave profile would look like with these diagrams. We'll have the same top jaw for both in the same position. But for the convex profile here, where that lower jaw is recessed, we see it much farther back. And this is going to be reflected in the lips and the chin as well, with this curvature, the convex profile. Now, when the lower jaw outgrows the top jaw, we may see it fitting like this, which will also reflect with this lower lip and chin being forward. Now, with each of these, we have some risks associated with them. If we were to look at the convex profile, these top front teeth are set way ahead of the bottom front teeth. If we were to fall, it's more likely that these top front teeth would get chipped or damaged. Now also, with these bottom front teeth being very set back, they tend to grow more in the mouth and get crowded. Now when we have crowding, as some of us may know, it's more difficult to clean in between the teeth with both your toothbrush and your floss. So plaque and calculus can build up around those teeth, causing some gum inflammation and potential bone loss or gum disease in that area. All things that we want to try to avoid. Now, if the lower jaw grows more than the top jaw, these lower front teeth are more at risk for trauma because they're set ahead of the top front teeth. Also, when we smile, we won't see the typical display of the top front teeth when we smile because our lips and our teeth are impeding this. There are numerous types of treatment modalities for growth imbalances. Typically, the younger we start, the better if we need to utilize appliances such as an expander or a headgear or a functional appliance to try to stimulate growth where it is deficient. Additionally, we can use braces and/or surgery in very severe cases to correct growth imbalances.